Hi, my name is Adil Mantkani. I'm the clinical lead for the designated site for vaccination at Birkenhead Medical Building. So the purpose of this video is to take you through what's been happening with the vaccination at this centre. We started vaccinating on the 14th of December in the very first phase, and to date, in the last 8 weeks or so, we have completed 25,000 vaccinations. For vaccination, the first thing that happens is they're registered at the reception desk, and all the patients are booked using an email system, which means that the vaccinators and others have access to their full medical records. The appointments are booked by the GP practices, and the public come here and they're registered at this particular place, and then they're asked to complete a pre-assessment form asking them to give their consent and to ask some questions regarding how they're feeling currently and issues such as allergy and any previous COVID infection. And once that is done, the patient, the person waiting for vaccination comes to this area where healthcare assistants and others do a pre-assessment of their everything for them to have the vaccination.
Are you fitting well today? Yeah? Open up for me. Okay. Do you have any new dry cough, temperature or taste or smell recently? Have you had any severe allergic reactions to any medication at all? Any vaccines? Do you ever needed an academic or anything? No? Have you ever tested positive in the last 4 weeks for COVID at all? Have you received any vaccines in the last 7 days? Yeah, and your time's absolutely fine. So today we'll be doing the vaccination. Once we do the vaccination, we'll keep you here for 15 minutes just to make sure that you haven't had a reaction.
So just one randomly?
Yeah. Is that
How long do we need second one?
They all need a second one. So basically 12 weeks from today you'll get a telephone call and you get your okay for the second one. Alright? Okay? You ready? Let's take you over to part 2.
Yeah, nobody's touched you. Squeeze. My name's Jenny. I'm a paramedic that working here at the moment, okay?
Yeah.
And this is Daryl, he's helping me as well.
Hi Darrell.
Are you well today?
I am.
Good. Can you just confirm your date of birth? Brilliant, okay. And your address? So you told me you're feeling well today, that's good. You don't have any new cough, high temperature, loss of smell or taste, do you?
No.
Okay. Have you ever had any kind of allergic reaction, severe allergic reaction?
Never.
So you've never had to use an adrenaline pen for any sort of reaction whatsoever? Okay. That's good. Have you taken part in a COVID vaccine trial at all?
No.
And have you received any other vaccines such as your flu jab or pneumonia jab in the last 7 days?
No.
Okay. And have you had a positive COVID test in the past 4 weeks?
No.
Okay, great. The vaccine we're giving today is the Pfizer-BioNTech vaccine. Okay. Much like the Oxford-AstraZeneca one, is given in 2 doses, one now and one within 12 weeks.
Okay.
We'll give you a little card to go away with, which is detailed the vaccine that we've given today with the batch number, and you'll need to come back. Obviously, when we call you, bring that card with you.
Okay.
All right.
Brilliant, thank you.
Is that as clear as the mud?
Yes, it certainly is.
Are you left or right-handed?
I'm right-handed.
Are we okay to go in your left arm?
Yes, of course.
Reason being, it's quite likely to give you an aching arm at the site of the injection, okay?
Right, yeah.
Should be resolvable though, you know, it tends to ease off after a day or two, okay?
Okay.
You might also experience mild flu-like symptoms, possibly a headache, a little bit of a fever, that sort of thing.
Okay.
And what we do say is just take paracetamol and take it easy for a day or two.
Right.
It should be self-limiting, and like I say, things should resolve within 48 hours.
Okay, cool.
If they don't, and you feel absolutely dreadful,
Yeah.
do contact your doctor or talk to 111 for advice.
Okay.
Is that okay?
Yeah, that's great.
Have you got any
Thank you.
questions at all?
No, not at all.
You're
Just
not
relieved to get it, to be
Oh
fair.
yeah, yeah.
Scary.
I know, it's a good thing, hopefully.
Yeah.
It makes a big difference.
You a carer for anybody at all?
I do look after my sister who's disabled.
And do you consider yourself white British?
Yes.
You not on any medication that thins your blood, are you?
No.
Okay, great. So we're going in your left arm.
Yes. How far up do you need it?
So we go with the upper, the muscle in the
You're
upper
going to have to do
arm.
that then.
Do you want me to close that door or are you
I
okay?
don't mind.
It's up to you. I'll close it over just for...
Okay.
Ready?
Yeah.
Just relax your arm on your lap
Okay,
if you would,
good.
alright?
I'm not going to look though.
That's okay. I wouldn't either.
I've seen it on the telly and that was bad enough.
Yeah. I'm not going to comment. It's a sharp scratch. Just relax that arm as best you can. Just let it go nice and floppy for me, okay?
Yeah.
Sharp scratch. Okay, I am just going to ask you to press just there.
Oh, have you done it?
Yeah, just
Never thought.
apply some pressure there.
Thank you.
It's okay, don't worry, I'm just going to pop this on.
So when the patients have been for the vaccinations, they come in to be observed for 15 minutes, make sure that they're okay and they don't have a reaction to the vaccine. And then we send them, it's a one-way system, and we send them through this door just straight ahead of us.
Okay, bye.
Take care.
Okay, thank you.
So as long as you're okay with us, go home at 5:15.
Okay.
I'll take this form off your phone. And there's a little question.
do we have to wait 10 minutes?
Just 10 minutes. Take a seat on
Oh,
the chair.
unless you no, but you have to stay.
Hi.
I'm the lead healthcare assistant here at Miriam Primary Care Group, and I've been given the responsibility of looking after the volunteers. We've got quite a big team who've come and joined us from all walks of life. We've got some World Council employees, we've got people who used to be in the profession themselves, and people who've worked with special needs and teachers and things like that. So we've got a big team who've come to join us. They help in lots of areas, in pre-assessment, in doing admin for the clinicians to help them, and they also help here in post-assessment with us as well. We also, during this period when we're in post-assessment, we do have a survey the Health Watch have asked us to complete, which is obviously for the patients to complete, describing their experience here while they've been within the Vaccination Hub.
We are going to give the AstraZeneca. We'll take it out of the fridge. Take the vial out. So I'll let you check that.
Yeah.
Remove the AstraZeneca.
Yeah.
Intake 05
Of 2021.
Okay, should be right. Okay. So we've got our little slips. And clean the top of the vial. Obviously it has to be up to room temperature. Clean the top of the vial. And you've got your orange needle. And we're drawing up 0.5 mils. Okay.
That's fine. Yeah.
And that's ready to give to the patient. Okay. Yes. BioNTech COVID-19 vaccine expires 05/2021.
Okay.
That's right. Sodium chloride 0.9%.
Yep.
Expires 01/2023. .8 mils.
Yep.
Okay. And 1.8 mils of air back.
Yep.
So I'm going to tilt it 10 times. 7, 8, 10.
Okay.
Very good.
Thanks, Mark. Point 3? Yeah. Cool.
You've taken a tablet.
Yeah.
Okay, so we're giving you Piriton tablet
Yeah.
just to see how things go. I'm going to keep you here for another half an hour or so. I don't want you to go until you're feeling perfectly fine.
Okay.
Okay, so just check your blood pressure again.
I'm sure.
What happened to the other thing? But they moved around.
No, good.
It has a pain.
Yeah, because I started not sleeping again.
I think a lot of this could be just anxiety too.
Mm-hmm.
So we might need to use a different machine. Okay, that's fine. We'll just keep an eye on you.
Of our records, patient consent forms in date order with the Pfizer injections, the AstraZeneca injections, and then we go to second doses, housebound and care homes. The main reason is if there's any queries, we can go back and find the paperwork on that particular day, and we've got the consent of the patient. If one of the documents isn't on farm outcomes, we can go back to the paperwork, get the information we need and update the records electronically.
Okay, I'm Susan. I'm an education supervisor for CPPE, so I supervise pharmacists education, which is my main job, but then I come to work at Miriam 1 or 2 days a week as well, helping to support the COVID vaccination programme. I really enjoy being part of it. I feel like we're doing something that really makes a difference to the residents of the Wirral. The centre's really well run and the team here are really, really friendly. So although it's really tiring, I really find it very worthwhile and I enjoy my days here.
Getting involved, helping through the pandemic. I'm not medical trained, but this is a way I can help do things. It's only data entry work, but it saves the vaccinators having to do it and they can focus on the vaccinations. Yeah, so it's good.
Very happy to be here again. I wanted to participate in the whole COVID pandemic, and having retired recently, I felt I had much to offer. I'm very happy having been taken on by the Miriam practice. It's extremely well run, and I'm not just saying that. I would say every second patient comes in and goes, "This setup is very, very smooth." It's interesting. I've learned so much about the COVID vaccine, and it's lovely dealing with patients again.